Hi everyone, say hi to Madelaine Golec. She has a master's in physiotherapy and is currently working on her Somatic Experiencing Practitioner certificate. As a pelvic floor physiotherapist, she's passionate about helping uncertain moms to be prepared for birth so they feel capable and confident in their body's ability to birth and recover. I think that's so strong and so empowering. I'm so excited. So today we're going to be talking about why our pelvic floors are important, what it actually is, because I feel like maybe a lot of women don't know what it is, and how we can actually use physiotherapy to help ease pregnancy, woes, and also, during postpartum recovery. So welcome to the show.
Thank you so much for having me. I am super passionate about this topic. And so it's like that perma smile that you kind of can't get to come down. So thanks for having me on.
Yeah, I think you're the first person on the show to talk about pelvic floors. And, we're already like 115 episodes in. So it's pretty cool to have you on. And I want to know more about it too. So first, let's get started. Like, how did you become a pelvic floor physiotherapist?
Yeah, great question. Well, I didn't know that this was the route that I was going to take, but in the midst of my 2-year master's degree, we have to go to various clinics to gain some experience and learn working with new patients. And one of my instructors was actually doing pelvic health. And this would have been back in it's like 2010, 2011. And at that time, pelvic floor physiotherapy wasn't really mainstream or wasn't widely available because we actually needed permission from a physician in order to do an internal exam. And then it was in 2011 that the rules changed, that we were allowed to perform it's called a controlled act. So we're allowed to now do it without having to reach out to a doctor and be like, hey, I'd like to do this assessment. Are you okay if I do that? So I was exposed to this field of physiotherapy that I had no idea existed. And I had had a pelvic surgery and I had had some symptoms that I just was like, oh, okay. I guess this is just something that happens when you have a pelvic surgery, like pain with intimacy. I was like, oh, okay. It kind of bothers me, but kind of doesn't, depends on the position. And so in the process of doing research for her as part of my project, I started learning more and I started learning techniques. And then I started them applying them to myself. And I was like, oh, things got better. And so I knew right from there that as soon as I graduated, that my trajectory would be moving towards supporting individuals with pelvic floor dysfunction. And so then 2014, started taking the courses and then obviously have continued my education in that field ever since.
That's awesome. I think I feel like a lot of us go into our fields from a personal experience thing, and for you to have that pelvic surgery definitely kind of puts you in that prime position to really understand more about it and also apply it to yourself.
Exactly.
Yeah, so today we're going to be talking about using pelvic floor physiotherapy for pregnancy and as a focus. I know there are a lot of other things that we could apply it to. So for pregnancy, what are the benefits of physiotherapy?
Yeah, so let's just talk about first the 5 functions, because I think that will highlight what makes the pelvic floor important. Why would we even care about these group of muscles? So first and foremost, they support us with movement. So they're part of our core. They help support our hips, our pelvis, our low back with movement. So those muscles being optimized, right, is optimal for movement. And there is research to show that there's a link between low back pain and pelvic floor dysfunction. So these muscles are not working on their own, they're working with other groups of muscles. So we want to make sure that they're just not completely ignored. So that's 1. 2, they support our organs. So it supports and holds the bladder, uterus, and rectum from trying to fall into the vaginal canal. So of course, we want those muscles and the fascia and everything to be nice and toned so that it supports those organs. 3, it's sphinctering, meaning helps us hold gas stool and urine inside so we don't pass it when we don't want to. 4, sexual function, right? It's really important for orgasms and experiencing pleasure with intimacy. So really important that those muscles are in their optimized position. And then 5, they work as a pump. So just like, for example, when you're on an airplane and they say like, move your legs to keep the circulation in your legs moving so you don't develop a blood clot in your leg. Well, the pelvic floor muscles help to do the same thing in and around the pelvis. It keeps lymphatic fluid moving, circulation moving, and certainly postpartum, when there's a bit more swelling there, right? We could slowly be using those muscles, and we do with movement anyways, but we can consciously use them also to help us with keeping blood flow moving along. So just from that perspective, getting to know where those pelvic floor muscles are, how do they move, what do they do, already allows us to understand that pregnancy and potentially birth may have some impact on those functions. So when you learn beforehand how to move those muscles through full range of motion, how to activate them, how to coordinate them, we're hoping to reduce the risks of developing an issue, and or if an issue arises, the individual kind of already has some knowledge about what they could be doing to aid their recovery process, what they could be doing while they're kind of moving through the healing journey before they come back and see us postpartum. So they will already know what they can do in pregnancy, they'll be able to do in postpartum to support them. So it's kind of like we want to do prevention as much as possible, but in the event that something does happen, we know that there's like options. Because I get a lot of clients who will come in, it's like, nobody told me that I might have bladder leakage, or nobody told me that I might have this issue. And it can be really distressful, right? All of a sudden these muscles just worked and now they're not working the way they need to be working. And then it's like, well, what do I do with this? Like, is this a problem? Is this going to be my life forever? Is there nothing I can do? And unfortunately, the messaging has been that like, oh, well, you've had children, so, just wear a pad and everything will be fine, but it's not fine. It's not fine for the person who's experiencing that didn't know, oh, this is a possibility. And then they don't know that there's an option for them to do something about it. So I really like the idea of like connecting to our body during the pregnancy journey to get to know what's going on down there, right? What's a norm, like what does it feel like when I squeeze now? And then I have a comparison postpartum to be like, oh yeah, that feels a little different, or maybe it feels a little weaker, or oh, something's, and then it gives you the option to ask questions, seek help. You'll already know that we exist. So that's why I like talking about pelvic floor physio in pregnancy.
That's awesome. I mean, I for sure did not know all that 5 functions of the pelvic floor. Of course, all of them are very important, including like holding all of the other organs up and making sure that everything's functioning well. Just a quick question. If someone's listening to this and they have like period cramps or, contractions during pregnancy, does the pelvic floor have a huge role in that? Or is it more of like, just like muscular?
So the experience of cramps in, let's say, like PMS type of thing can be a number of different factors of what is causing the brain to perceive the sensation of cramping. If there's pain or an unpleasant sensation that is being experienced in the body, what is our normal reaction? Like if I jam my thumb in the door and it hurts, right, I'm automatically going to tense to try to brace the pain, right? It's like a natural, automatic, almost reflexive response to tense. The problem is that the more we tense and brace against the pain, the more it can contribute to more pain, because it begins to create dysfunctions that, if left tense for long periods of time, can cause like blood flow changes to the tissue. Then that tissue is going to start to get angry. In between those tissues may be nerve endings. If the nerves aren't getting a good oxygen blood supply, they're going to start to get angry. So then you can start getting referral pains, nerve-like symptoms. If you've ever had your leg fall asleep, it's pretty uncomfortable when you start to feel the sensation of blood loss, right? So we don't necessarily think about that, but that can happen to our pelvic floor. And if we're left with a contracted pelvic floor for long periods of time, it can lead to urinary frequency, urinary urgency, bladder leakage, constipation, pain with intimacy or pain with penetration, nerve-like symptoms, maybe potentially some congestion in the area because those muscles are like not flexible anymore. So it's not per se that like the muscle is causing cramps per se, because again, that could be a number of different reasons, but there's going to be a feedback that goes back and forth. I have a cramp, my muscle tightens. Now my muscle starts to cramp because it's not getting enough oxygen and nutrients and blood flow, and they can start feeding into each other where it starts to turn into a vicious cycle. Does that kind of answer that?
Yes, I think I can picture it. Like it's like a forward feeding cycle, basically.
Yeah. And I mean, there's going to be other contributing factors, like what's the, inflammation, that's in the body. Is there a lot of systemic inflammation? Is there gut issues that causes inflammation? Because again, all of those organs are around each other. You can get organ crosstalk. So there's a lot that could be happening there. And then like in terms of contractions in pregnancy, like when you're moving into the contractions, I mean, that is a whole different process. It's not a pathological, like it's not a medical condition, obviously. To have contractions, actually a really important physiological function to get us moving into labor and then ultimately to birth, so that you can have like false contractions called Braxton Hicks. And then you can move into like real contractions. And of course, if you're having, contraction like feelings or cramps, like early, or something doesn't feel right, at that point, you really do want to reach out to your medical provider to find out like why you're having cramps or why you're having contractions that are early, perhaps in the second, first or second trimester, right? That's obviously something that you don't want to go into premature labor, right? So those kinds of things, I would say, like if you're cramping or having contractions or having some, kind of sensation that you're not sure of, that's a direct line call to your medical provider. I would say that's not likely a pelvic floor physio call. Definitely not first until all the sort of medical things have been checked out.
Right. Okay, got it. So when we talk about, benefits of using physiotherapy for a pregnancy, I heard that, earlier you were saying like the pelvic floor, would help us to have really good blood circulation and help our bladders to function pretty well. Are there any other benefits that we missed out on in terms of like pregnancy?
Yeah, well, I mean, so we do other things in pregnancy. So for example, it's really quite common to experience low back pain or pelvic girdle pain during pregnancy. So for example, like you may experience pain turning in bed, or you may have a sharp shooting pain the moment you like try to put your pants on. So anytime you try to lift one leg while one leg is like on the ground and you get a shooting pain sort of in the groin region, that may be a sign of some pelvic girdle dysfunction. Going up and down the stairs, taking long walks, oftentimes what we see is an issue with weight transfer. So anytime I have to transfer weight from one side to the other and there's pain, it may be pelvic girdle pain, which who better than a physiotherapist to basically assess to see what is happening? We have a variety of tests that we do to confirm that that is the case. We take a comprehensive, subjective assessment to be like, okay, is this something potentially, is it something else? Is it coming from the low back? Because sometimes pains can come from the low back. And there's some really great exercises that we can be getting you to do to help you minimize, if not resolve, those pain symptoms. Most of the time, I'll have clients come in postpartum and they'll say, I had terrible pains, like it was hard for me to move around. And I was like, didn't anybody recommend physio? They're like, I didn't even know that was an option. I just thought, oh, I'm pregnant. And like, these are just pregnancy pains that, everybody just deals with. Meanwhile, we could have been supporting you to, if not fully resolving, making things so much easier in terms of your activities of daily living, like getting you moving better, getting you, finding different strategies. If you can't put your pants on standing up, okay, what are the strategies we can use in sitting down? Or what modifications can we make where you're not having to just deal with the pain? You're actively then supporting your body. And that can decrease distress as well, right? So those are other reasons that, seeing a pelvic floor physiotherapist during pregnancy can help, because we can work on your low back, we can work on your pelvis, we can work on exercises that are going to help support your entire pregnancy, right? Because our hips are shifting, where our weight is changing. It's like a weight that we've likely not maybe experienced. And our muscles, although they were great at supporting us here, with the shifting and the changing of our bodies, our muscles might not also be keeping up. So it's like, okay, how active are you? Okay, you're not as active. Okay, what are some ways we can find for you to be more active? And we also have studies that show that, individuals who are more physically active during pregnancy tend to experience easier labors.
That makes sense to me.
Right?
Yes.
Your muscles are resilient. They're used to being worked, and they recover easier, and they have more endurance and more ability to support you for this marathon, because labor is a marathon. Like, and you don't get to be like, can I have like a water break? It's like, when it's on.
Yeah, like, it's on.
So we really need to think about like, how ready is our body to take on this marathon? And that's going to also, play a part in our recovery as well. So we do like core preparation, like how do we help you support your abdominal wall? How can we make sure those muscles are as strong as they can be safely? Because when it comes time for, pushing, you want those muscles to be able to generate that power to help with the pushing phase. So it's not just, the pelvic floor, but it's all the supporting muscles around the pelvic floor that we need. Like, people will say, I'd like to squat a lot during my labor. Well, if you're not used to squatting, your quads are probably going to burn out after about a minute. Right? So if there are certain laboring positions that you are like, oh man, I want to make sure that I can do this. Like, we need to prepare those muscles for being able to withstand what potentially could be 10 hours of labor. Those muscles really need to be ready for that.
Awesome. That sounds like so much work and support that you provide these women, and it really changes their life. Like, based on pain perception and how they can function day to day for like those months of their pregnancy. You mentioned earlier that, this will eventually help the women to recover better as well, which I am guessing is like basically because they have a strengthened core, or like, their core is not weakened as much. Would that be correct?
So I would say, if you're going to go in, let's say if you're going in for a knee surgery, oftentimes the surgeons will say, I want your muscles to be as strong as they possibly can be, because it's gonna, when you come out of that surgery, you're going to be that much stronger, right? Because you're going to have some change in the muscular tone. But again, if that muscle's used to being exercised, it's going to be used more set up or more optimized for the recovery. right? Because the muscles are used to, you have good, blood flow to that region, because when you're using a muscle, you also have to get more blood vessels in there because there's more muscle to feed, right? So anytime there's a good blood supply, good nutrition coming to the tissues, they recover, better. The other part is that, we talk about, and I didn't mention this, but we also prepare you down there. So it's, learning how to stretch some of the tissues, and that how to massage that area, which again, the studies vary in terms of the response, but the last time I looked in 2020, there was like a systematic review. So they took 11 studies on perineal massage or perineal stretching. So like 1,700 did prenatal care and perineal massage techniques, and like 1,700 had just the standard, prenatal care with no massage techniques. They found decreased stage 2 labor. They found less episiotomy use, less severe tearing. So there was a protective response against 3rd and 4th degree tears, and that those individuals recovered better and they tolerated pain better. Because for me, when I teach the perineal techniques, it's not just about the tissue stretch. It's the ability of your ability to be able to relax against unpleasant sensations. Because remember when I said in the beginning, when we experience pain, our natural instinct is to tense. Well, if that baby's head is coming through, but I'm tensing, that baby's head is still coming through. So it can potentially increase the risk of a more severe tear because I'm tensing, but the pressures, the expulsion reflex is still going to bring that head through. And so if I'm more tense, of course, you can have greater injury. But if you've learned to release the tension, not just in the pelvic floor, which is a technique that we do teach, but it's like relaxing the shoulders, relaxing the jaw, relaxing the, stomach, all of those things, because the jaw tension in here coincides with how much tension is in the pelvic floor. So if you're like this, yes, I'm relaxed, in all likelihood, you're not very relaxed in your pelvic floor either, right? Yeah. So it's not just stretching, it's the mind work of learning techniques to release and let go against unpleasant sensations.
I love that. It's like, it reminds me of actually not even just pregnancy, but like day to day, if we're like really stressed from things, like it's like kind of like practicing mindfulness and being like relaxing against that. I love that. It's very relatable.
Yeah. And so we do a lot of pain education. I do a lot of pain education. I do a lot of nervous system education. I really try to help my clients, it's not just preparing the physical body, it's also the nervous system that is a self-protective automatic responses. And so I feel really strongly that when we understand, when we have knowledge, that already starts to reduce fear. And anything that we can do to begin to reduce fear reduces and knowledge also reduces distress, right? So if something happens and you know nothing about it, it's way scarier than if I have some knowledge around it. Then I know, okay, I can ask this person, these are the questions I need to know, who do I need to reach out to help, to get help. But if I don't know something, it's super scary. So when it comes to preparing for labor, it's like, how much information can we provide you that helps you feel more confident that you know some things, right? And again, preparing the nervous system. So learning about pain. Why is pain there in the first place? Does it mean that something is being damaged? That doesn't necessarily mean pain in labor doesn't necessarily mean there's damage. And it actually serves an extremely important physiological response. And I literally just did a podcast last week on how how labor pain gets a bad reputation, right? Because it's especially in labor, we're so scared of labor pain.
Right. Also, it's portrayed in like, TV and media. Like sometimes I feel like it's also an exaggeration, and I don't know because I have not given birth yet. But yeah, I mean, I totally get it. Like, we're always seeing that, and so like it's almost like a foreboding sense of
Yeah. And it's so interesting because, I had that imagery
right.
of labor, and then during my pregnancy, there was a moment where where you realize it's like for reals.
Yeah.
Like it's for reals. Like I'm pregnant for real. There's a baby growing and it's got to come out.
Right. That's
and
terrifying.
even being a pelvic floor physio, like, don't get me wrong, I'm not exempt from fear.
Right.
I was like, oh, damn, like this baby's got to come out. But I knew enough to be like, okay, get to my pelvic floor physio. Yes, I have my own pelvic floor physio. And then I went and took prenatal classes. I took hypnobirthing. And one of the most beautiful gifts I think I was given in those hypnobirthing classes was they would show us videos of women giving birth that did not match the media.
Oh, that's so nice. Yes.
And so when I went into labor, and like, don't get me wrong, it's intense. And like, I gave birth with no epidural. So I had no like pain medication whatsoever. So I did it all natural. But and I had this vision in my mind, and I was just like, just remember those, like, just remember them. Like I had being able to witness that it is totally possible to be in your power and not be overwhelmed by the intensity of the labor contractions. So I would just hold this vision of those women in my mind. I'm like, just be like them, just practice your techniques. You can do this, just breathe. And so don't get me wrong. It's not that I didn't experience unpleasant sensations. It just, they didn't have the same power. Like I wasn't afraid of the sensations. I understood what they meant. And I used the techniques to help me work through the sensations. I wasn't trying to get rid of the pain. Well, in a sense, I was.
You're trying to go through it.
The pain motivates you to move. So I'd be like in this labor position, then it would get too difficult to be in this position. So then I would switch and I'd be like, oh, okay, that feels a little bit better. And then that position would get too uncomfortable. Then I'd go to the next position. So I was seeking comfort, but I wasn't aiming to be pain-free. I had the tools and the techniques and the vision in my mind because I really prepared. And there was a point when I went into labor, I was like, I told my midwife probably at least on 3 occasions, like, I don't know if I can do this. And she's like, you're doing great. By the 3rd time, I'm like, seriously, I'm not sure that I can do this. She's like, oh, we're ready to go. Like, never once did she offer me an epidural because I was like, I don't want one, so don't offer me one. But she just gave me these words of encouragement, and I'm like, okay, I'm not alone. Okay, I can do this. I can do this. I can do this. Just focus on just this one contraction, then worry about the next. And then all of a sudden it was over. And almost instantly, it's like your brain goes into amnesia where you can't quite remember the intensity. Like it gets kind of glossy. Like, it was intense. You went through something, but you can't quite. And I think that's an evolutionary built-in thing, because if we remembered it to its exact intensity, we may never have children again. So there's so many beautiful,
so yeah,
it's just so many beautiful things that happen in the moment that, it's a rite of passage. That's all I can say.
I bet. I mean, from your description, it's already so transformational, especially for the woman giving birth in terms of mindset and being able to feel her body and also just go through that. So, we're talking about birthing now, and I actually wanted to shift into traumatic births because that is also, something that's happening. Can you talk a little bit about how traumatic births is linked to our nervous system, linked to our pelvic floors, all that, the kind of bigger picture around that?
Yeah. So, I mean, this could be like a whole.
This could be a webinar.
This could be like a whole big thing.
Yes.
But what I'm going to say is that, there's various definitions of trauma, And it's essentially, it can happen when something happens too fast, that's too overwhelming, that's too quick for me to respond in a way that my body needed to respond. So the self-protective response gets interrupted in some shape or form, meaning like I could be in labor, something's happening, and then maybe they need to put me under to, do a C-section, or something happens. My nervous system is going to mobilize to protect me, right? So we have these different responses from our nervous system, like fight, flight, freeze, potentially dissociate, right? If it becomes too overwhelming and I can't escape, then I'll have to dissociate because I don't have any other option for making it through this experience. And so in the birthing phase, it doesn't have to be something big. And I think people, when they hear stories of individuals who had, let's say a more traumatic experience, when they might express their story, you might be thinking, oh, well, that doesn't sound like a very big thing. So it doesn't matter. It doesn't have to be this big thing where like, oh my God, I had a lot of blood loss and I almost died, although that can be traumatic, but that doesn't automatically mean that person who's having that experience will be traumatized. So we need to be careful when we're listening to people's stories, not to be like, oh, like you'll be fine, or, oh, that doesn't sound like a big deal, you should just get over it. That's not how this works when it comes to trauma and how our nervous system holds this information. So, if something scary is happening, I'm already mobilizing into my sympathetic nervous system where I'm preparing for fight or flight. So I'm, there's a number of responses. I feel in danger. I want to look around and see who my support system is. Like sometimes the trauma happens because I just didn't have the support that I needed to make it through this. Maybe my healthcare provider wasn't very sensitive to something I was experiencing. Maybe my partner didn't know what to do. And, we're both like, something's happening in labor. We don't know. He doesn't know. Medical staff isn't really giving us a lot of information. They're just kind of like, we need to do this, 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 and this. And you feel like you're losing agency and, you don't know. And your mind is somewhere else in the middle. Like you're not, when you're in labor, you're kind of in your own little realm, right? So there's so much that can be happening. And if we don't have a good sense of support, like if I'm in the middle of a jungle and I start hearing rustling and I'm like, I'm going to pause, I'm going to look around and be like, okay, is there anybody close to me? We want to be socially engaged. Well, let's say nobody's around me to help me. What other systems do I have in place? Well, can I fight? Well, if I have an epidural, I'm probably not going to be running away from the situation. Number one. Number two, I may not have the energy to fight. And like, who am I going to fight? Right? Like if it's a medical provider saying something or something's happening, I may not have that option, but my system is like prepared for that. Right? And if I can't find a level of safety in that moment, what other option do I have? I'm going to have to separate myself from this experience because it's too overwhelming. And that can get lodged in the body. And from there can be a whole set of symptoms and issues with attachment with the baby, all kinds of things that can happen. So I think, we need to understand that these things, do happen, and the degree to which somebody will or will not be traumatized is going to vary person to person. And it's important, I think, that if somebody's saying they had a really hard birth, we need to validate that. Like, man, that, I'm sorry that your birth was really difficult. And, how can I support you versus, other responses? Because then that just becomes re-traumatizing. Then the person wonders, like, is there something wrong with me? Like, why can't I get over this? And it just does not lead to good, it may lead to mental health problems, then other health related issues. So it's important to understand that it's not just something that we experience in our mind, trauma, it's something that we experience in our bodies, and we may be showing responses of that. So, I encourage people, if they feel like their birth was really difficult, please find a trauma-informed therapist to work with you, to work through that. Like, don't, we say, oh, well, at least the baby's safe. That does not help the person who's experiencing trauma, or who is experiencing difficulties thinking about or relating to their birth experience. Like, there's nothing wrong with you. Your system was overwhelmed. There was, a series of events that need to be supported. And so finding a good healthcare provider to support you with that, because again, that can also translate into the physical body, which can also translate to the pelvic floor. So for example, if I had a tear that was centered around also a traumatic experience, maybe I wasn't told that I was going to get an episiotomy, and then the episiotomy happened. Then I tore on top of that. And then I didn't get the support I needed from the medical staff. And then maybe my tear got infected. That person's probably going to have a neuroimmune response that's going to be more sensitive. So then when it comes time to be intimate with your partner, that person's not going to feel like, oh, great, now something's going to touch me there. Like, they may not be able to go there, right? The pelvic floor may hold a lot of tension and a lot of protection, because if something happened to my body without me knowing, and then it resulted in a big injury, I'm going to be holding very, very tightly, and I'm not going to want anybody or anything going near there, which then could spread into issues with, intimacy, and, well, what about my relationship? And then what does that mean for me as a sexual being? And what does that mean for me? There could be bladder issues and bowel issues as a result of, these experiences. So again, not that every tear results in trauma, but again, it's like, what are all the things that were happening? So it's not, is just baby okay? It's like, is mom okay too? Or is the parent, the birthing individual okay?
Right. Yeah, I'm so glad that we talked about this, because I think that's not really talked about. And also, like, I like how you phrase, like, every birth experience is someone's true birthing experience, and we have to acknowledge that. And also, that physiotherapy can really help with, like, if someone had a traumatic birth experience.
Yeah. So our role, like, not every physio may have trauma informed courses behind them.
Yeah.
But like, just I think we're going to help you with the physical realities of what is presenting. I just have that extra layer of being like, well, before I just even go there, like, let's see how you're doing. Like, what's happening in your body? Is your body getting tense with the idea of me even doing a physical exam? Okay, let's just work on supporting your body and your nervous system to feel okay with the idea, right? And sometimes, clients can have a bad experience because if we just go there too quickly, and there is potentially some history of, and it doesn't even necessarily need to be birth trauma. There could be sexual trauma. There could be other traumas. Like, we just need to be receptive to be like, how is this person, how are they responding to me just even describing what the physical exam is going to look like, right? So it's like, how do we approach this person to know, oh, okay, like, are they going to be okay with me touching them? And if not, okay, well, there are other ways we can get into the pelvic floor to teach you relaxation that doesn't require me to touch, doesn't require, and thank you, virtual therapy, for really teaching me how to work with the pelvic floor without touching. Because 2 years of virtual pelvic floor, physiotherapy has taught me some amazing skills around how do we help support people without even necessarily physically touching them. And it can be done. So, that is to say, there could be physical consequences that were traumatic, like physical injuries, but not all traumas are going to have like a physical signature, but could show up in pelvic floor tension. Like, there may not have been a tear, but there's like chronic tension in the pelvic floor that is a self-protective response. So trauma can show up in that way as well.
Awesome. I love your description. And as you were talking, I realized that you're not just like, physiotherapist for pelvic floor, like just do all the structural and physical things. I realized that you really look at everybody individually, trying to see where they're at, if they've given birth, right? Like what's your birth experience like? And I really like that. I feel like that's very in line with functional medicine and also, everything I talk about on the show. So that leads me to my next question, because I really want to just get a big picture
Yeah.
of how you help women prepare for birth and postpartum recovery. I know you have a 5-pillar approach to that. So can you let us know?
Yeah, absolutely. Well, first and foremost, because of my somatic training and my real like deeper understanding that like connecting to our body or reconnecting with our body is so important, because we live all up in our heads, and we probably half the time forget that we exist below the neck, right? So the first step is connection. How do I connect to my breath? How does my breath influence my pelvic floor? Can I even sense that that connection exists? Can I connect to my abdominal wall? Can I breathe in, relax it out, bring it in? Can I feel a muscle squeeze? Can I feel it let go? So I always start with first connection. Where's the pelvic floor? What does it do? How does it move with the breath? Sometimes I'll get them, to kind of squeeze different areas of the pelvic floor, and I'll ask, well, what does that feel like? Does that feel different than over here? What do you notice? What's the quality of the movement? If, oftentimes I'll use like different imagery, like, oh, when you squeeze the back end, does it feel like an elevator going up and down? Or does it feel like elevator doors closing, right? And so we use imagery. I use like towels, I use a ball, I use the breath, and we just start to like create that mind-body connection, because you cannot see your pelvic floor, right? You can only feel it. So if you've never really looked at your pelvic floor, if you've never really engaged with it consciously, right? First, let's see if our Google map is clear. Because you can have a destination and Google's showing you the map, but if the map's blurry, you're like, oh, do I turn here? Do I go there? Like, where am I going? So let's clear up that Google map, so you know that whatever your brain is telling that muscle to do, that muscle is then responding. So I start with connection. From connection, we practice relaxation. You gotta be able to let go. And we've already talked about, why that would be important. If a baby's head's trying to get through and you're trying to get the baby to come down, well, if you're squeezing through here, I mean, how is the baby's head gonna wanna engage if we're not giving it the space to do so? So we learn relaxation techniques. From relaxation, we need to learn how to activate. So that's where it's like, okay, let's like really learn how to properly do a pelvic floor muscle contraction. And there's like so many different ways to do a pelvic floor contraction. That's why we don't call them Kegels really anymore. I mean, I use the word Kegel because that's what everybody kind of knows what it means, but a Kegel is so much more than just a squeeze. There's so much more that goes into it to make it more optimized and more functional. Once we've gone from activation, then we're like dealing with pain. So if there's low back pain, pelvic girdle pain, we talk about pain, we start working with perineal stretching and whatever sensations are associated. So we need to work with pain or resolve pain or manage pain. And then there's like the preparation piece, right? What exercises can I do? How do I prepare the perineum? How do I prepare for early postpartum? Like, what am I supposed to do? What exercises are safe? And so those are kind of like the main pillars. And then of course, there's like exercises and things underneath each of those. You're on mute.
Sorry. So I have connection, relaxation, dealing with pain, preparation. Was there something that I was missing?
Yeah, the third one was activation.
Oh, sorry. Okay, got it. Okay, I'm gonna just write this down so people will know in the show notes. So that's really cool. I mean, like, I just think like knowing your process is really enlightening, because a lot of like health stuff is like, change your diet and like get better sleep and all that, and yours is like really specific to like the pelvic floor. And also when you're talking about like connection and all that, I was trying to like breathe be like, can I actually feel something? So that was actually really interesting as you walked us through that approach. That was really cool.
Yeah, thanks. I mean, it's been like something that I've been working with all
Yeah.
the time, right? It's like, you have your pelvic floor training, then you go through your own birth, then you go through your
Right.
own pregnancy,
And
then you
you're
go through your
tweaking
own
it.
rehab, right? Like I still had to do my work afterwards, right? And I do a high contact martial arts sport. And there was just no way that I was going to return to that sport while peeing my pants, which like if I coughed, sneezed, jumping jacks, that was a no-go. And jumping jacks are part of running, and jumping jacks are part of our warm-up. So I was like, okay, like I need to train. Like I can't just like go back. Like somebody's going to try to break my arm. I can't think about if I'm going to pee my pants. Like I need to make sure my bladder is like in full control. And so like for anybody listening out there that maybe does high contact sports or does something, like just because you had a baby doesn't mean you can't return. And it also doesn't mean that you're like gonna have to wear a pad to do those activities, but you're gonna have to put the work in. And like I was very diligent to make sure that I took all the time to work on all the things that caused me to leak. That's, I really spent time on gaining back that control. And it can be done.
That is very inspiring, I think I would say. I mean, because like the commitment to like, even just like meditate or move every day, some people are already like finding it so difficult to do. So I think it's really good to have that goal in mind. So if someone's listening to this and they're feeling some kind of pain, or they want to find out more about like how to use their pelvic floors, first of all, I have a question, like how does one actually find the right physiotherapist for them? And also my second question is, how would someone find you if they are relating to you?
That's great. Well, I believe you're in the US and I'm up here in Canada. So there's that like that
right.
So what I would say, like in terms of finding a therapist, that there's a number of different ways you can work with therapists nowadays, especially with the pandemic. Obviously, you can work with one in person. You can work with one virtually. And then there's online programs. So with the first two options, the in-person and the virtual, you're probably going to need to find somebody that's like in your jurisdiction. Like I can only do physiotherapy treatment in the province of Ontario because that's where I'm licensed to practice. So I can treat anybody in all of Ontario. Thank you, virtual therapy. Or I'm like in Mississauga, Ontario, if you want to see me in person and you have to be a resident of Ontario. So that should answer that question for those Canadian listeners. That's where you can find me in Ontario. Now, there are many directories available to find pelvic floor physio, and certainly Google can be one to find somebody near you. And when you're like looking for a physiotherapist, if you're not sure if it's a good fit, like most of them will have a conversation with you, so you could kind of say, hey, this is sort of what I'm looking for. What's your approach? Like, don't be afraid to ask questions of the person you're wanting to see if it's a good match, right? I can have all the certificates and all the degrees and all of the things, but there has to be a good vibe, right? For it to really work and that it feels good. Like it feels like a good fit. So I always say like having a conversation with that person to be like, is this a good fit for me? Great. You can always, most of us have some form of social media where you can kind of get to know us, get to know our personality, get to know our style. So you want to just make sure that like those pieces are matching, obviously that they're, qualified to do pelvic floor physio. I'm not sure how it is in the US, but I believe you have to do extra training to be a pelvic floor physio in the US, but I don't know. So I will just speak to Canada. And specifically Ontario. Like for me to practice pelvic floor physio, I had to do additional training outside of my master's degree. And I have to be registered with the college that I do this controlled act. because in Ontario, it's a controlled act and you must be registered and qualified to do so. So that's public knowledge. Like you can Google my name and you'll find me on the College of Physiotherapists of Ontario, and you'll see I'm rostered to do internal exams. So you want to make sure the person's qualified. You want to make sure a person's a good fit. You can ask them also about, have you taken courses in pregnancy? Not that necessarily doesn't mean that they can't support you. It's just like a question that you can, if that's like a make or break deal for you, that they have more additional training. I mean, in our pelvic health training, we certainly talk about the pelvic floor and, touch upon pregnancy. So it's not like we don't have that information, but some people might be really wanting somebody who's specifically done some extra training. So you can ask those questions, take a look, follow them on social media. Those are great ways to kind of see if you think they would be a good fit for you. And then to the second part, so I talked about in-person and virtual. So the third option is online programs. There are physiotherapists who now are creating online programs because we understand that I may not be able to provide service outside of my catchment area, but I want to help as many people who are looking for it. So there's a lot of DIY programs. I happened to create a DIY program because I was like, oh, well, maybe there are people who don't want to see me in person. Maybe the idea of having somebody internal or having to talk to somebody about something, maybe if they feel embarrassed or they feel unsure, they're like, I don't even know what to ask. Online DIY programs are great for that because you don't have to talk to anybody. It's like you sign in, you watch the videos, you go through the exercises, you do your thing, you get access to similar information. It's not a physiotherapy treatment, right? It's a DIY program. Just like if you were taking a recipe book, you're like doing it yourself. It has all the guidance there for you to do it. And then if you really feel like, oh, now I'm ready to see somebody in person, or I want some feedback, or I want to talk, or I have questions, then that might be a good time to reach out to somebody in person or in a virtual treatment. So a DIY program is a great foundational place to start, and can be helpful because by the time you make it to the therapist, they're not going to have to talk to you about all the basics because you've already gone through the anatomy, the physiology, how to relax, how to contract. So we can actually kind of just get down to business, right? Do our assessment and be like, oh, okay, I can see where you're having difficulty, or here's the feedback that you've been needing. We don't have to do as much of the education and explaining that we would do if you hadn't seen or hadn't done some pre-research. So
yeah,
I do that. My DIY program is available to anybody in Canada or the US, and that can be accessed online. I think I'm going to send you the link, or do you want me to?
Yeah, send me everything. Also right now, if you do want to share your social media, whatever, your masterclass coming up, just go ahead.
Awesome. Well, you can find me on Instagram at my name is at Madelaine Golec. And I'm going to suggest that you definitely go to the show notes because most people do not spell my name correctly.
Yes, it's very unique.
It's very unique and it's very long for me to go letter by letter, but it's at Madelaine Golec. You can totally find me there. I'm hosting a free masterclass on Saturday, April 2nd. It's at 10 a.m. Eastern Standard Time, and it's totally free. It's a free masterclass, and it's called How to Prepare Down There for Birth. And we're going to talk about 3 pelvic health myths. I'm going to share kind of my exact blueprint of what are all of kind of the things that's involved in preparing down there. I'm going to do some live demos. So I have a lot of, not diagrams, but what's the name? Props. I have props in my clinic so I can show you some live demos, and I'm going to have a live Q&A. So it's a great opportunity then to ask your pelvic health related questions. Now, obviously I can only answer them generally because you're not my client and I haven't assessed you. So I can't give specific advice, but there may be some general questions of when can I start? When is it too late? And any other of those types of questions, I'd be more than happy to answer. And so the link for that is, ecophysio.com/masterclass. And again, the exact spelling and the links I believe you'll put in the show notes. So that will be there. I also offer a free mini training on how to work with labor pain to have a more positive birth experience. And that's ecophysio.com/mini training. It's a free 30-minute training on pain. So I got lots of free resources. And then of course I have my paid DIY program, or happy to see you, virtually or in person if you're in Ontario, Canada.
That's awesome. I'm going to link all of that in the show notes for sure. I'm so happy I got to chat with you today. For those of you who didn't know, like we just arranged this for months and it didn't happen till today. I actually learned a lot about pelvic floors and even just like birthing, and like it's so interesting and so insightful. Thank you so much.
Oh, thank you so much for, giving me a chance to have this conversation. And I'm not used to being on the like interviewee side. So it's kind of nice to
That's cool, yeah.
let go and be like, oh, you get to be the host. I just get to sit back and talk about what I love to do. So it's kind of nice, that role reversal. So
yeah, I totally get it. Sometimes it is really nice to just not be the host, but well, thank you for joining us, everybody, and we'll hope to see you next time.